Welcome in to Let's Be Honest. I'm your host, Kristin Cavallari, and I have Nashville's #1 plastic surgeon at my house, Dr. Unger. Thank you for being
Kristin.
here.
Thank you so much for having me. This is such a treat.
This is going to be a good episode because we're not going to hold back. And I know that plastic surgery is such a hot topic for so many people. People have a lot of questions about this stuff. So we're just going to dig into it all.
Absolutely. Let's do it.
Is it true? Well, I always thought it was true that plastic surgeons specialized in one thing. Like I know a lot of plastic surgeons do everything, but aren't a lot of people known for like noses or boobs, but you're good at everything you do. Like literally everything.
That's sweet of you. It honestly changes based on geographic area. So, New York, LA, and now more so in Nashville, as markets kind of mature, we find that people tend to try to get known for one thing to try to build their practice there.
I see.
I mean, if you have good training, and most of the training in the U.S. is good, you should get well trained really across our fields.
Okay.
And then you tend to find what you like to do. And so, I have things that I definitely do a lot more of, and things I do less and less.
What are your favorite things to do?
So, I do a lot of breast surgery, a lot of like mommy makeover type stuff, breast and tummies, and then a lot of facelifts. And so those are kind of the two boats that I play in mainly.
So there's so much I want to say. Okay, in my head, I think what makes the most sense is instead of going like the Botox filler route, doing a facelift. What age do you recommend doing a facelift at?
So loaded question, but I actually agree with you. And there's a role for small things because sometimes we only need small touches and tweaks, and that makes sense. But as you continue to age, aging is really two things, right? Facial aging. It's volume loss. You lose fat in your face as you age. The thinner you are, the faster you'll see that. Yeah. You might see some of like your heavier friends that look a little younger as they get older, right?
Yeah.
And then, of course, tissue falls, right? And so once you start to see that change, the best time to do it is really as it's beginning to bother you.
Okay.
Because your tissue is stronger. The change is more subtle. It's a longer lasting result. Okay. And so you can kind of maintain yourself in a more natural, harmonious way if you do it on the younger side.
Right. Because that's like Hollywood's secret is people getting facelifts before it's too late. Or not too late, but before it's noticeable.
Before it's crazy noticeable.
Yeah, exactly.
Right? Totally.
And then do you just do one facelift, or is that something that you have to do multiples of as you age?
Right. So
like, let's say I start at age 45.
Yeah. So listen, what I always say is that a facelift is permanent in that the improvements you get are going to be there forever. Now, that doesn't mean that you stop aging, right? So things will continue to move, but when you're 60, you'll look a lot better if you had a facelift at 50 than if you didn't.
Okay, right.
But there might be enough new sagging and volume loss that you'll want to do something again, right? And so
it's like my boobs. All of a sudden, I'm like, why are my boobs sagging again?
Gravity's pretty tough to beat.
Shit's real.
I mean, it's really, that's a tough one. So, it's a totally Hollywood secret, and the people from that kind of group that I get to see from time to time, I have performed 3rd and 4th facelifts on people who aren't that old because they've just maintained. They've just kind of looked great forever, and they never seem to age, right? And that's kind of the secret.
What's the recovery like on a facelift? Because it scares the shit out of me.
Oh, well, it shouldn't because
says the plastic surgeon.
Right. It doesn't hurt me at all. So what I like to say about a facelift, it's a longer, delicate, tedious procedure, but there's very little blood loss, and the recovery is pretty easy. You don't use your face for much, right? So your arms and legs work just fine. Yeah. My patients are up and moving the day of surgery. I want you,
really
going to the bathroom and walking around the house immediately.
And this is a full facelift.
Full facelift.
Okay.
Full deal.
Okay.
And the swelling and bruising is really minimal, and the pain is really minimal. It's probably the least painful big surgery we do.
Really? Yeah. I thought when you did the lower, like you can't even open up your mouth for a while.
Well, I don't want you to like chomp a steak that night, okay? Because all the musculature in your neck and a really good facelift or a facelift that's going to last is done on what's called the deep plane or the deeper layers of the face. Oh. Because pulling on the skin, like what you did in the 90s, giving that like, smushed back look.
Oh, so you're like pulling on the muscle?
It's all the muscle. It's all the deep stuff. Okay.
Whoa. Oh, so back in the day, they only touched the skin.
Yeah, in the old days. Like those silly pictures you think about from like socialites in New York in the 80s, like super pullback face.
Whoa.
Because we didn't quite understand what was really happening. Okay. So now you have to cut the skin, of course, to access everything. But the skin, a little skin comes out because the deep face is moving back up.
Oh my gosh.
But that is not the point of the surgery.
sounds crazy.
It's all the deep stuff.
Okay.
And so you move all of that back, and then it just lies in a nice, natural, more tight position. And it's, so it's the muscles that you're really pulling on. So you don't want to chomp a lot or like do a podcast that day.
Yeah. Maybe wait a day.
Maybe a week.
Well, yeah.
Because you want to let all that stuff kind of heal into its new position before you overly stretch the muscles.
Okay, that makes sense. So you're literally sewing the muscle up.
Yeah.
And then where are the scars for a facelift?
So super hidden, right? They tend to go, to some extent around. They change for each person. So for
Okay.
me, I really try to individualize everything, including where the deep tissue goes, where the skin goes. But in general, it goes around the ear, usually behind this part of the ear, the tragus.
Oh, inside of the ear.
Right on the inside here.
Wow.
My ears are clean. I didn't know.
Yeah.
And then
Like,
around the ear lobe.
Okay.
And the crease behind the ear here.
wow.
And then like along the hairline or into the hair a little bit here.
Oh, wow.
And
So that's for lower.
And so a lower facelift allows you to access the jawline and neck. And then a quote unquote full facelift really just means that incision goes around the ear, and that gives you full access to the whole cheek. Okay?
Oh.
If you think about, the forehead or the eyebrows,
Yeah.
that's a brow lift or a forehead
Oh, that's
lift.
not considered a facelift.
No, so, yeah, so-
oh, okay. So a facelift is just the lower part.
Yeah, the
really.
facelift is kind of the mid-face and the jawline and the neck,
Oh, I see.
technically speaking.
Okay, so right. So this is a
You're going to
brow.
be a doctor by then.
I know.
because, yeah.
This is so informative. I'm learning so much. So if you want to raise your eyebrows, that is a brow lift
Yeah.
specifically, and those scars are up here, right?
Correct.
Yeah. Okay.
And there's a handful of different techniques, of course.
Yeah.
But in general, it's a small incision buried in the hair that allows you to get a little lift. Again,
Wow.
what you want to do is get the tail of the brow up, like that pretty elegant shape.
Okay.
Nobody wants to be super surprised.
Right.
You don't want to pull in the middle. Again, the 90s, overdone quite a bit. And now it's
Okay.
really all migrated to kind of just that lateral or that side temple region.
Interesting. And then what about the eyelid surgery that everyone's doing right now? That's really popular in
Yeah,
Hollywood.
for sure.
So what is that?
So the technical term is a blepharoplasty.
Oh.
Yeah, we have fancy words for everything. But so the brow is kind of the stabilizing. That's the footprint of the eyelid, right? Because you think about the brow skin, that kind of blends into this. So part one, make sure the brow is in the right position. If it is already, then you're fine. If it's a little low, it might need to be lifted.
Okay.
And then the extra skin and possibly a little bit of fatty tissue that pooches out around the eyelid.
Yeah.
You make a little incision in the natural little crease, cut out a little skin, little muscle, sew it up.
Oh my God. It's like gives me the heebie-jeebies.
I do these awake all the time.
No.
It takes 25 minutes.
No.
People go drive themselves home.
Awake?
Well, I don't want them to drive. Yeah, awake.
But
all the
they're,
time.
like watching it happen?
Well, you can't. It's on the top of your
Holy
eyelid.
I mean, I got LASIK eye surgery and that about put me out.
Okay, no, but that's your eyeball. We don't operate
That's
on
true.
eyeballs.
Yeah, but just like the fact
Yeah.
that like my eye was open and
No,
I was
so
watching
your eyes
it.
are closed for it. and you
Okay.
I tell stories.
Yeah.
It's like a whole thing.
You got a
It's-
comedy show.
yeah.
Wait, that is wild. And then
Yeah.
you can do underneath too,
Underneath,
right?
Yeah, then there's a lower blepharoplasty or lower eyelid surgery.
Okay.
Which is usually a little different because what tends to happen here, those deep circles and
Yeah.
those lines, that's really where you start to see facial aging, right?
Yeah.
And so as your cheek, which is not happening on you because you're perfect,
Yeah.
but as your cheek falls down and the fat in this part of your face starts to fade away, the bone becomes like more visible and you get that circles and those creases.
Oh.
So I like to take a little bit of your own natural fat, add it back in to this area.
Oh,
Yeah, so
cool.
cool.
Wow.
And then sometimes there's like the puffiness here.
yeah.
That's from a relaxation of the eyelid itself, like just stretching out just like the neck stretches.
Oh, wow.
And so you go inside of the eyelid. Now you're going to get freaked out. You go inside of the eyelid and pluck a little bit of the fat out from around the eyeball to help smooth that back out.
Holy shit.
So there's no scars. And then usually for most people these days, unless you have lots and lots of extra skin, you don't even cut skin out here. You might do a laser.
Oh.
You might do radiofrequency microneedling.
Okay,
You
yeah.
might do a chemical peel. Something to just kind of smooth that skin out and improve the tone and texture.
Wow. I didn't realize so much went into that.
Yeah. Lower lids are more complicated than upper lids
Okay,
as a
yeah.
general rule.
And like, so when can everyone go back to work after these procedures?
Well, it kind of runs the gamut, right? So if
Yeah.
you do your upper eyes, like I say, if you come in, you can come in. I do those in the office
That is
if that's all you're
crazy.
having done. People go back to work. If you have a desk job, you might work from home the next day. No problem.
That's it?
Oh, yeah, there's no downtime.
Whoa.
No, I don't want you doing push-ups or headstands, right?
Yeah,
for a little
yeah,
while.
yeah.
You might get some bruising because it's
Yeah.
very delicate skin.
Okay.
Stitches are out by day 5.
Wow.
And with a facelift, well, let's say you do the whole thing,
Yeah.
right? But you're young, you have good tissue. The older you get, the kind of more swelling you get because your skin's not very strong, right?
Yeah.
It can't press back against the body's natural tendency to swell.
Yeah.
So for most people, and we'll get to the average age in a minute. I know we're all dying to hear. But for most people, I say you're restaurant ready, meaning you could go out to dinner with girlfriends or whatever in like a reasonably lit restaurant and no one can tell at 2 weeks.
Oh, wow. But how long does it take for it to be 100% the swelling?
So
is
camera
all,
ready,
yeah.
6 weeks.
Okay, but I mean, that's not bad.
I mean, the scars are hard to see. And, I always show people on my phone, I pick the consults or the post-ops that came in from that day to show them not like the best ever.
Yeah.
Just this is what it looks like at 6 weeks for my patient from 6 weeks ago every time. You can't see them. I mean, they're gone
You can't.
in 2 weeks.
Yeah, you really can't. I mean, I know
Even
a few
close-ups.
people who,
I would
men.
imagine you do.
Yeah. I know a few men who have had
Yeah.
facelifts. And
I love doing male facelifts.
do you?
Yeah.
I think they're more common than people think, right?
They should get more. I mean, they are. I'd say it's, in my practice, it's probably the number one surgery I do on men.
Oh, interesting. Okay.
Let's talk about Bon Charge. Bon Charge is a holistic wellness brand with a huge range of evidence-based products to optimize your life in every way. Founded on science and inspired by nature, all Bon Charge products adopt ancestral ways of living in our modern day world. Their extensive range of premium wellness products help you sleep better, perform better, have more energy, recover faster, balance hormones, reduce inflammation. I mean, the list is endless. From blue light glasses and infrared saunas to red light therapy to EMF management and circadian friendly lighting, Bon Charge products help you naturally address the issues of our modern day way of life effortlessly and with maximum impact. My favorite product from Bon Charge is their red light face mask. It helps with wrinkles and fine lines, sore jaw, eczema, even migraines and acne, scar tissue, wound healing. It's also just incredibly relaxing. It also helps with razor burn and ingrown facial hair. It's super lightweight on the face and it doesn't get hot. I've tried a lot of other brands, but they did not even compare to Bon Charge. And I don't know, guys, I've had a lot of compliments on my skin lately. People have been saying that I just look refreshed. My skin's growing. I've had virtually no breakouts, which is a huge win for me. And I really do feel like my fine lines and wrinkles they feel a bit softer, which, hey, I'll take. Bon Charge also has other amazing products like blue light bulbs, blue light glasses, EMF protection products, which you guys know I love, infrared sauna blankets, and 100% blackout sleep masks, all backed by science. Bon Charge's products are HAS FSA eligible, providing up to 40% off. You guys are definitely going to want to check them out. Go to boncharge.com and use coupon code HONEST to save 15%. That's BONCHARGE.com and use coupon code HONEST to save 15%. This is for all my carb lovers, which is definitely me. Let's talk about Hero Bread. Now that it's summer, we're doing more grilling. We're outside a lot more. I do find that, bread and buns, they become essential with all the burgers, hot dogs, lots of sandwiches, with kids being home now from school. And just because it's summer, it doesn't mean you have to cut out all the carb heavy foods that you love. Hero Bread reinvented the bread and buns that make summer great. Fluffy, delicious flavor and texture with no net carbs, 0 grams of sugar, and fewer calories, plus protein and fiber. And now you can try their sweet melt in your mouth Hawaiian rolls for guilt-free summer sliders. Guys, I'm not gonna lie, I'm obsessed with Hero Bread because it is so fluffy and delicious. Their new Hawaiian rolls, I don't know about you guys, but I was obsessed with Hawaiian rolls growing up. So when I saw that Hero Bread was coming out with them, I couldn't wait to try them. And they do not disappoint. We also, just for lunch with the kids, because they're home now, we make a lot of sandwiches. They also have tortillas that we love. We do a ton of quesadillas at my house. So all of their products I'm obsessed with. I was surprised by their texture when I first tried Hero Bread because I've tried some of the other, less healthy bread products, and they don't even compare to Hero Bread. Hero Bread is so fluffy and delicious. I also love that they have fiber in them. You're cutting down on sugar when you eat these products, and the fact that they have protein in them. They just check so many boxes, which makes me so happy. One thing I'm going to do coming up, which I'm excited to try, is I'm going to do French toast with their bread. And I feel like that's going to be a game changer. Keep the carbs out of summer without compromising flavor with Hero Bread. Get 10% off your order at hero.co and use code HONEST at checkout. That's honest at HERO.co. Here's a brand you guys know that I absolutely am obsessed with, and that's LMNT. Healthy hydration isn't just about drinking water. It's about water and electrolytes. It makes sense. You lose both water and sodium when you sweat. Both need to be replaced to prevent muscle cramps, headaches, and energy dips that result from dehydration, which is less common, and low electrolytes, which is more common. Element has your electrolytes need covered with 1,000 milligrams of sodium, 200 milligrams of potassium, and 60 milligrams of magnesium. It contains enough electrolytes to move the needle towards each of these electrolyte goals. They're also introducing LMNT Sparkling. No sugar, no caffeine, all electrolytes. LMNT Sparkling delivers the same zero sugar electrolyte formulation you already know and trust. LMNT Sparkling offers health seekers an all new option to support their health across a broad spectrum of occasions. You're also guaranteed to find an element flavor that you love. You could try fan favorites like citrus salt or raspberry salt. You could get spicy with mango chili, or you could even mix chocolate salt into your morning coffee for a mean mocha. I personally love their grapefruit. I have a subscription that I get every single month, and I'm obsessed. So guys, get your free sample pack with any drink mix purchase at drinkelement.com/honest. And if you're an LMNT insider, you have first access to LMNT Sparkling, a bold 16-ounce can of sparkling electrolyte water.
Let's talk about boobs.
Let's talk about
Okay, and everyone's gonna ask.
Big fan.
Big fan of boobs. You did not do my boobs. However, when I redo them, I'm coming to you. I've seen 2 pairs of your boobs, and they're both phenomenal because they look natural. They just look perfect. So explain the different types of boob jobs that you can have, because there are quite a few.
Oh, for sure. And again, for me, and I guess part of what I'm known for, one is natural results that are designed to kind of fit your body and fit your frame and work with what your natural anatomy allows for.
Yeah.
And then 2, you really have to tailor the surgery to each patient's needs, right? And so a youthful breast, just like a youthful tummy or youthful face, is making sure the skin envelope matches kind of the deeper tissue, right?
Okay.
If you have too much skin and not a lot of boob, then that's like a saggy, hangy, like not filled, not taut, not youthful shape.
Which is when you need a lift, right?
Correct.
Yeah.
Right.
Okay.
So see, you are a doctor.
Well, because I had one. I'm okay to say that.
So we want to make sure everything is balanced in the right position. We want to make sure there's enough volume. So there's a couple ways to get volume back into the breast. There's fat grafting and there's breast implants.
Fat grafting? You just take your own fat and put them in your boobs? What?
Yes.
And it looks great,
it
feels
looks
great, it's smooth, it's all the things.
It's all the things. It's wonderful, but it's really more adjunctive, meaning fat can help from contouring and shaping. You can't build what we call core volume. It's kind of like sand on a sand hill, right?
I see.
You can't just squirt a bunch in there. If fat worked that way, we would never use implants.
Okay, right.
But to give real shape and kind of give a new projecting breast, after children, a lot of times people have no breast tissue
No, it's
left.
disgusting. Yeah, I remember bending over just like loose skin, and I was like, oh God.
Listen, it happens to everybody,
Yeah.
right? And so if you want to recreate some volume and make sure that it's obviously when you place a breast implant, you know exactly what you're getting. Fat is a little more delicate, and there's a little bit more nuance to it, but it's a lovely way to kind of improve shape and contour.
Yeah.
But real volume is an implant. And then of course there are multiple types of lifts. I do probably 6 or 7 different approaches.
Oh, wow.
Depending on what's going on.
Okay.
With the
what
goal,
are this? I only know, I know I've got like the one scar down, but then I know there's also the anchor
underneath.
What's the difference between those two? Why do one over the other?
Well, so it kind of depends on where the nipple is positioned, how low on the breast it is, how high in the breast it is, how much extra skin there is in both directions.
Okay.
This way
I
and
see.
this way.
Right.
Right. And so if there's too much skin from, your neck down to the bottom of your breast, if you just, we're getting into geometry, but if you take the breast and just narrow it in this way, it's still going to be too long of a breast. So you can use the fold and tuck in that skin and shorten the breast that direction.
Do you take the nipple and literally put it in a new spot?
You do, but it doesn't come off.
Oh, well, okay.
So people think the nipple comes off and you stick it back on like a sticker. Okay.
That would be insane.
That actually is a thing that can be done, but it's not done very
so
commonly.
wild.
And you do that with extremely large-breasted women. I mean, you're talking about watermelons,
like a reduction,
that are so large, because you have to keep the blood supply and the nerve supply alive to the nipple.
Right.
You need to cut around it. That's why there's always a scar all the way around.
Yep.
So it can be loose within the tissue and move it, and then sew it into a new spot.
So crazy.
You have to make sure blood flow, the roads need to be connected from the heart on their pathway to the nipple, right?
Right.
And so you have to keep it connected in some way, and there's a multitude of ways to do that, and that's why we have anatomy. I say what we do is art, bounded by science and anatomy.
Yeah.
Right? So I can't just draw whatever picture I want.
Yeah.
Unfortunately, I have to use, what the body will allow me to do do that.
Right.
And so depending on how far the nipple has to move, how much extra skin there is, the scar pattern changes.
Okay, that makes sense.
It's tailoring.
Yeah. And what kind of implants do you like? Are you saline? Are you silicone?
Yeah, so that's a great
Shaped? Like, aren't there like the
great question.
teardrop shape?
There were. So not
they're gone.
In the US, they're essentially gone.
So I almost got them, and my doctor was like, they can shift. And if they shift, it looks fucking crazy. So thank God I didn't get them.
Yeah. So I was really fortunate. I did a lot of research years ago on those implants. I worked in Europe for a little while where they had those implants 10 years before we had them.
Oh.
So I got to see the 10-year out problems.
So, and they were moving. Is that what it was? That was a big issue?
They can give what's called a double capsule.
What does that mean?
It means, so scar tissue naturally forms on our breast implant.
Yep.
Just like it does around a knee, artificial knee or a pacemaker.
Yep.
The body just puts scar tissue around any foreign body.
Yeah.
It's not a problem. It's just natural. But because the shaped implants had to stay right where you put them. So they're kind of sandpapery.
Mm-hmm.
Okay. So it's called texture, and texture is essentially gone in the US for a variety of reasons. If that texture was stuck under the muscle and then you do something super active, it could kind of tear like Velcro.
Oh, wow.
And cause there to be a fluid collection and then a new layer of scar. So you have 2 capsules.
Dang.
And we saw that a lot as time would go on.
And what does that look like? Like,
externally,
yeah. Can you tell?
if the fluid collects, it can get swollen.
Because I feel like the tops of mine are really swollen. Like, I feel like it's like scar tissue, though. Do you think?
It could be.
Yeah.
Yeah. You know, I mean, and so that scar tissue can become a problem.
Yeah.
If it's something called capsular contracture, which I think all women need to know about. I talk about it in 100% of my consults.
Yeah.
It's the most common complication of breast implant surgery. It's not dangerous. That won't harm your health. But it's where that scar tissue gets irritated and then it kind of gets extra thick and extra tight and makes your breast hard.
I mean, they're not hard, but like they're like puffy at the top.
Yeah.
Like, and I feel like if I really massage it out, then they'll like lay better.
Interesting.
I know. Maybe I'll have,
Yeah.
maybe I'll have you look.
After the video.
After the video.
Yeah.
But is there truth to, because like back in the day, wasn't the whole thing like you had to get your boobs redone every 10 years?
Right.
I still don't know the answer to that. Is that true?
No.
Okay.
Isn't. And that's a beautiful thing. So saline silicone, number one, everyone should know that all implants are silicone. Okay. But the difference between the two is whether there's salt water inside or silicone gel inside.
Oh.
Okay.
Okay.
In the olden days, 90s and early 2000s, the shell or the covering, the sac, was thin and tended to break more easily.
Oh.
Saline tend to break more easily because they have more ripples and wrinkles because it's just water inside.
Got it.
The silicone gels, the old version was kind of like shampoo. And so if it broke and you left it alone, it could leak.
Okay, right. Yeah.
And again, that leaking could cause some local tissue damage even, and it'd certainly be kind of messy.
Yeah.
So because of the data we had, we say we should just change them in 10 years, try to head that off, make sure the rupture rate was lower.
Okay.
With the silicone implants that most people use nowadays, they're gummy bears. Have you heard of that term?
Yeah, I have.
So it's like a cohesive gel or basically a
So if
solid
it's split,
gel.
it doesn't like
Doesn't
seep
go
out. I
anywhere.
think that's what I
You can
have.
cut it in half.
Yeah.
Right? Cut it in half and just sits there.
Okay, yeah.
So in those implants, you don't need to be as concerned, and the rupture rate is much, much lower because the reason they would break, it's called a shell fold failure. So it would be full. I know, I'm getting so technical. I don't know how to not.
I love it.
I'm trying to be normal, I promise. When that circle folds over and it kind of rubs on itself back and forth, like after a decade, it can like crack.
Yeah,
right?
okay, right.
But now, since they're firmer, they don't tend to have those issues.
Got it.
And so they tend to not break.
Okay.
So the advice I give my patients is, we're going to check you. I'm going to follow you forever. I'm your doctor forever. If there's a difference or a change or something we need to evaluate, the FDA has some recommendations on monitoring for MRIs or ultrasounds.
Yeah.
We can do all of that. But if there's no changes and there's no problems, you don't have to just go swap them out like an oil change.
Okay. That's nice. Yeah. I mean, again, because mine are 7 years old and I do all of a sudden, I'm like, they aren't laying how they used to. So I guess if it's more like just a cosmetic reason.
And so here's what I tell most of my
Aging
patients.
is a bitch.
Yeah. Implants have gotten so good that the reason why you're going to want surgery is probably not because of your implants. It's because of gravity.
Yeah.
And skin changes.
Yeah.
And what was nice, cute, and tight is now longer, not as cute and as
Yeah.
tight. Right?
Yeah.
And so and you're not going to leave old implants in, obviously. If it's been 15 years, we're not going to be like, leave those old things. We'll just cut around
We'll
it.
get you some freshies.
Yeah.
Yeah.
Freshies.
Some freshies.
Yeah.
Okay, yeah, I love that.
That's my new tagline.
We'll get
Come
you
in for some freshies.
We'll get you some freshies here at Dr. Unger's. Okay, so the top surgeries you do, you said facelifts and like a mommy makeover.
Yes.
So mommy makeover is boobs and tummy tuck, right?
Right.
And then a lot of times people will take their fat and put it in their butt too, BBLs. How common are those?
I think it depends on your practice. I mean, so a mummy makeover, in my mind, it's really just restoring your own natural shapes and giving you back, the sexiness that you deserve and helping to fix things or put things back into place that you can't do on your own, right? You can't exercise away extra skin.
Yeah.
You can't exercise your abdominal muscles all the way back together if they're really wide.
Oh, so do you like fix abs? Like you like sew them back together if
All
they've
the time.
split? Oh, interesting.
And that's because when you get pregnant, the rectus, right, the central ab muscles, your six pack, split apart.
Yeah.
And they don't usually quite get back together.
They never do.
No.
Oh, interesting.
people.
Oh, I didn't know that.
Yeah. And so, a lot of moms have like low back pain all the time.
Yeah.
And feel like bloated after meals. And you can do Pilates till you're blue in the face. And listen, some people are super lucky and they come all the way back together. Most people don't get that lucky.
Yeah.
And so you can repair that muscle wall. And all of a sudden, you have your core back.
Oh,
When you do
wow.
a plank, it feels good. That sense that women have like their guts falling out when they're upset. That goes away because you put everything back together.
Wow. Oh my gosh.
And sometimes people have, extra fullness on their sides and they have extra fullness on their hips. Whatever it
Yeah.
is, it's really an all-encompassing term to allow you to do multiple different procedures to give you back what you're looking for.
Okay.
And so BBLs is something you can do. Right?
Yeah.
And for me, it's a smaller subset. I do, again, with my aesthetic, it's a little more athletic. It's kind of softer, more natural. So call it a skinny BBL or an athletic BBL.
Yeah.
It's really just taking some of the fat that we suction out to help get the right shapes and contours in the tummy and maybe the backside, and then using it to help fill in kind of the hip dips or just to create a little bit more shape and contour.
Okay.
Touch.
Just a touch. Okay, but the recovery on the BBL is pretty intense, right? Because you can't sit on your butt for like 2 months.
It's pretty annoying.
How
I
do
will
people
say.
function? Like what?
Well, it's 6 weeks.
Oh, okay.
And,
Well, still.
when there's a will, there's a way.
Yeah, I
Kristin.
guess.
I mean, so you can sit on your hamstrings on a stool.
Okay.
We have these little like pillows to help and little setups in your bed. And
Damn.
it is the one kind of difference maker for me. Like when we're talking about the recovery and then if someone wants to talk about that, I do take pause. I'm like, okay,
Yeah.
things just got a little bit more annoying. It doesn't
Yeah.
necessarily hurt more. It's just there are less positions you can safely be in, especially if you had a tummy tuck and your breast down, you can't lay on your stomach.
It's a lot.
So if you're like just getting like some huge butt down in Miami, then you just like sleep on like your stomach like a starfish for
just
6 weeks.
laid out for 6 weeks.
I mean-
How do you go to the bathroom?
Well,
I'm like,
everything still works
I need
normally.
to know the logistics. Yeah, but how do
Everything
you sit
still
on
works.
the toilet?
Yeah, you can sit. You're allowed to sit for like a second.
Okay.
I mean, what I really warn people about is I don't want you getting on a super long flight on like a hard chair and sitting
Yeah.
on all that fat.
Yeah.
I don't want you driving your car for a long period of time.
Okay, right.
If you think about the way you actually sit though in a chair, you sit on your sits bones, right? Those is the bottom of your pelvis. That's not where you're adding fat because you don't want like a dumpy
Oh,
butt.
I see. Right. Yeah.
So it's more the top, more the sides.
Oh.
So it's more like side compression or sitting back against something for long periods of time that you don't want to do.
Okay, that makes sense. All right, noted. I could use a BBL, but I don't think I'd ever do it. I'm just gonna keep doing my squats.
I think you're okay. Yeah. Just keep squatting it
Yeah,
out.
I would try really hard for that little butt. What about labia reconstructive surgery? Do you do that?
I do.
You do?
Yeah.
What's the
Labiaplasty.
recovery like on that? I need to know
super
every.
easy.
It
It's actually
is?
shocking,
So
you know?
what do you do for that?
So, again, it kind of runs the gamut,
Yeah.
right, of needs. I really, I don't do like vaginal reconstruction.
Well, what's the difference?
Good question. So the inner portion of the vagina, kind of the vaginal opening or the
Yeah.
introitus, that can be stretched out. You can have tearing during childbirth, things like
Okay.
that. That's kind of sewing the actual pelvic floor back together. That's more
Whoa.
functional.
Okay.
I leave that to, OBGYNs
Right.
and reconstructive
Okay.
gynecologists. But a labiaplasty, which is
Mm-hmm.
typically refers to, it can be, the outer lips or the inner lips,
Mm-hmm.
mostly the inner lips. And, there are a lot of issues that come up over time. It can be from childbirth. It can just be natural. It can be very uncomfortable to ride a bicycle, or if they're extremely long, ride a bicycle or ride a horse in our neighborhood, right?
Yeah.
Or uncomfortable in yoga pants.
Yeah.
Pain with intercourse.
Oh, wow.
So essentially, it's a fairly straightforward procedure. You know, the hard part of really everything we do, or what really matters, is kind of, in my opinion, the aesthetic eye of the surgeon, whether it's facial shape or, any contour. You want to just remove some of the excess mucosa. It's just like mucosa inside of your mouth. And you just do it in a couple different layers and remove it so that...
Is it like a cut?
Yeah.
Like an actual cut? Yeah.
Yeah,
Wow.
you trim it away and then you sew it up in a couple layers to make sure that it's not, you don't take too much out, because then you can have vaginal dryness and a bunch of other problems.
Oh my gosh.
But you remove enough that it alleviates the symptoms.
And there's no harm, no downside to that. Like, we don't need all that skin, I guess.
No.
So
But again, you can overdo it and then there's a problem, right? Because it's protective and it helps, maintain a moist environment and all these important things. But people that come to me for it anyway, it's typically it's a functional issue or a sexual issue, and they're just kind of too much. It can be stretched out from a variety of reasons, like we said, like childbirth. So you just kind of clean it up a little bit, just like a little extra skin.
And how is the recovery on that?
I don't really do it commonly alone. It's typically in conjunction with a mommy makeover or something.
Okay, yeah.
And so it's such a small procedure, people literally don't complain at all.
Really?
Yeah, a little...
I guess if you've had a kid, you're like, that's nothing.
Right, so like a little spray, post going to the bathroom, some cool packs.
It sounds like, after having a baby.
It's completely healed. Like, it's mucosa, meaning inside the mouth. It's super vascular. It heals incredibly quickly. Within a week, the stitches are all dissolved. It's gone. You can't see anything.
Oh, they just
it's
dissolve
done.
on their own.
You have to
and
wait
when
a little
can
while
you?
to have sex.
I was just gonna ask. Yeah. Okay. How long?
6 weeks.
So it's like having a baby.
Yeah.
Wow, it's so interesting. You really do it all, Dr. Unger. Look at you.
Yeah.
Okay, what is the hardest recovery and then the easiest recovery out of everything?
That we've spoken about.
Or we'll know, unless you have something else that you want to tell us.
Hardest, most involved recovery is going to be mommy makeover. An involved one with a tummy tuck. Obviously, BBL adds an extra layer of difficulty on there. What we tell most of our patients is the liposuction is what really hurts the most.
Oh.
So suctioning out all those areas, you're just like bruised and beat up.
Okay.
That's very precise from a contour standpoint.
Yeah.
But liposuction works with suction and basically, a metal tube that we use in areas to suction out fat.
Yeah.
So it's kind of like beating you up pretty good.
Okay,
right? So
yeah.
It's never super, super painful, but it definitely hurts for everybody.
Yeah,
and tummy tucks are uncomfortable because you're bent over.
Yeah.
And probably the easiest recovery from a major surgery standpoint is a facelift.
Really?
Yeah. And breast surgery, if it's revision, I do a lot of revision. You say, what are you known for? So I have the opportunity to lecture around the world at like all these meetings with plastic surgeons, and all these plastic surgeons hang out together and do lots of boring stuff. And so what I usually am asked to speak on for those is breast revision surgery, meaning secondary or third or 10th breast surgeries, fixing problems and complications. Some of those can be really complicated, but they're pretty easy to recover from.
Okay.
Because there's typically already a pocket where the implant was, and you're really just cutting out some skin and fat.
Yeah.
So
I had my boobs done twice because I got them done after I breastfed Jackson, my second, and then I got pregnant with Sailor. Right. And then so as soon as I was done breastfeeding Sailor, I was like, I'm just going to redo them, and just because they looked awful again because I breastfed with them. And the second time was so easy. Yeah. I mean, it was such a breeze.
Right. See, that's their perfect example.
Yeah, it really, and I remember Carmen Electra actually said this to me years ago, but she was like, oh, you've never done your boobs? She's like, each time, because I think I had seen her right before I was about to do them the first time. She was like, each time is so much easier. And it's true. Yeah, thanks, Carmen.
Let's talk about Rhoback. The best way to describe Rhoback is best fit, best feel. They recently launched a new women's line, and comfortable would be an understatement. If you like being comfortable while still looking cute when out and about during the day, Rhoback is for you. Let me tell you about their active dress, which is actually my new favorite. It's made with their signature GTG technology, which allows you to keep your dress on when you're on the go and you got to go. The fabric is lightweight, breathable, and just really, really comfortable. It's cute and functional at the same time. You guys know that I love to exercise. I try to 4 to 5 times a week, and I'm very particular about what I wear during my workouts. Their new Sunrise Active Shorts and Hit Tech Tank are perfect for hot summer workouts. Both items are sweat wicking and made with fabric that allows you to move freely and feel ultra comfortable while you exercise. I've also adopted this as my new go-to walking outfit. I just absolutely love them. Finally, Robach's Swift crew necks and Tempo hoodies are so dang soft, it's unbelievable. I don't know what they did, but I can't take them off. They pair with the shorts, skirts, and even the dress so well. So, guys, if you haven't already, it's now time to try out some Robach. Use the code HONEST on robach.com for a generous 20% off your first order through the end of this week. That's spelled RHOBACK.com. That's 20% off all shorts, tanks, dresses, hoodies, and more with code HONEST. Stay comfortable with Robach. Let's chat about the brand Skims. You guys know that I'm not one to hold back from the truth. So when I tell you that Skims makes the best t-shirts, you know you can trust me. As a mom and CEO, I need shirts that I can wear for recording a podcast, straight to meeting up with friends, or even a play date. Something that's very versatile that I can wear all day. The Skims cotton jersey t-shirt is my absolute favorite. I just know that it's always going to look good and work. My vibe is, for the most part, just jeans and a t-shirt, and you just can't go wrong. This t-shirt fits like a glove. It's this lightweight cotton, perfect for running errands, and you can even wear it for a hot date. Also, the Skims soft smoothing seamless t-shirt is the most flattering t-shirt I've ever worn. Just imagine your favorite white tee, but better. Like I said, I only speak the truth, and this shirt is the best. Throw it on with your favorite earrings, necklace, and you're good to go. We just recently got their cotton jersey t-shirt in bone, which is kind of an off-white, and their soft, smoothing, seamless t-shirt in onyx, which is their black. I'm always going to go for neutrals when it comes to t-shirts just because they pair well with everything in my closet, and I'm just a neutral girl. You're not going to find a lot of color in my closet. Shop the Skims t-shirt shop at skims.com, now available in sizes extra, extra small to 4X. And if you haven't yet, be sure to let them know that I sent you. So after you place your order, select podcast in the survey and select my show, Let's Be Honest, in the drop-down menu that follows. Let's talk about water, specifically Smartwater. Anytime I see Smartwater at the airport or the gas station or wherever I am, I always grab it. It's so easy, just fits right in my purse. It's easy to hold, fits right in my cup holder, which, let's be honest, you guys, that's always really important when you're in the car and you have a drink with you. So I'm always reaching for my Smartwater bottle. And Smartwater is the smart way to hydrate no matter what the scenario is. If you're on the move, working out, or if you're just hanging out. I am such a freak about water. I always have a water bottle with me. I drink a ton of water a day. Yes, it's annoying because I'm peeing constantly, but I can't speak enough about how important it is to stay hydrated. That's one of the reasons why I love Smartwater. It is with me everywhere I go. Honestly, you guys, it's my favorite accessory. In a world filled with overthinking, we're provided a refreshing change of pace, a moment of clarity with a simple choice of hydrating with Smartwater. If you guys have ever tried Smartwater, then you know it has this pure, crisp taste and is obviously so hydrating. It's vapor distilled through a process inspired by the clouds. And Smartwater has added electrolytes for taste. That's a big deal. Guys, life is full of choices, and Smartwater is a simple one. Visit drinksmartwater.com to learn more. That's drinksmartwater.com.
Okay, speaking of reconstructive surgery, what's your best story of someone coming to you wanting to fix something where you just like totally changed their whole life?
Oh, I'm on the spot.
I know. I was going to text you yesterday. Like, this is one question.
Well, there's people who come to you and, you can make some really meaningful impacts to people's lives. And then there's people like from training that show up on the door. Those stories are pretty interesting. Like I've had to reattach a couple of penises.
No.
Yeah.
Come on. What do you mean?
And hands. Those are interesting too.
No.
And arms. Yeah.
Someone like shows up with their penis in their hand and they're like,
yeah.
what
Usually
happened?
It's on ice. We did 3 of them where I trained.
No.
Yeah.
What happened?
It's not a good day.
Yeah.
There have been a variety of reasons.
Okay.
So they just come off, and then you can. But it's microsurgery.
Sew it
so
back on.
we use microscopes in plastic surgery. We're trained to do reconstruction, rebuild all parts of the body. And then aesthetics comes out of finding the prettiest form in rebuilding function.
Yeah.
That's our basis. And so you go into the microscope. You put all the tubes back together, all the blood vessels. You get some help from urology for sure, from the urethra standpoint. You rebuild everything.
Whoa.
they're able to get erections before they leave the hospital.
No way.
Yeah.
That is wild. I had no idea.
Yeah, so that's pretty interesting.
Okay, that's very cool.
Yeah.
Quite literally saving someone's life.
Yeah, and then I also do a lot of, and I used to do quite a bit more, but a lot of breast cancer reconstruction, and that's super meaningful.
Yeah.
It's obviously a huge problem in the United States for
Yeah.
whatever reason. So 1 in 7 women get it. I see women younger than my wife with breast cancer all the time.
It's crazy.
And to be able to, of course, everyone's worried about saving their life first and their children and everything else, and as they should be, and of course. But then to be able to give someone back their sense of femininity and allow them to feel whole and complete, and sometimes aesthetically look even as good or better than they did beforehand, is super meaningful, and it's like a nice thing to be able to do for someone, for sure.
Absolutely. Yeah, that's really nice. Have you had patients who just don't like their results? And what do you do? What do you do?
It's tough. We talk about this in our meetings all the time, right? And it runs the spectrum. I'm fortunate that it's not common or for there to be a lot of big issues, right? However, that doesn't prevent somebody from not liking the results. One of the running lines amongst plastic surgeons is some of our happiest patients have the worst results aesthetically, and some of our least happy patients have the best results.
Yeah.
And that's a state of mind, and it could be a problem with explanation and education. So you have to have a lot of empathy. You have to be really patient. I mean, my approach is, I always want my patients to be happy end of the day as much as I can possibly make that happen any way, shape, or form, right? And so you work through it, you talk through it. Sometimes there's a small adjustment. That's easy.
Yeah.
Okay, things stretched out on your right breast a little more than your left breast. We can go and remove a little bit more tissue and make it match better. Or, your right cheek, you feel is a little flatter than your left cheek. Maybe we can add a little bit more volume into that side, or something along those lines.
Easy.
Simpler fixes that we both see.
Yeah.
The real hard part, is when patients are really displeased with something and there is no objective issue.
Right. Okay. Yeah.
Or not much of one.
Yeah.
Right? And so then you're kind of stuck because you're like, I'm happy to do anything for you, but there's nothing. I don't really have a solution for this particular problem.
Well, like the eyelid surgery, that changes the way people look. I mean, it really does. And I know someone in LA who she had it done and she hates the way she looks. But it's like one of those things where it's not like anything the plastic surgeon did. It just changed the way she looks.
But I would argue, without knowing anything about this case, so there are different ways to do eyelid surgery. So there are some even more aggressive things that I didn't mention, what changes the shape of your eye is if you cut the corner of the eye where the eyelid attaches to the bone and move it. So I don't do that at all.
Jeez, that sounds...
So it's called a canthoplasty, again, fancy word. But if you start to change the shape of the eye, you need to talk to the patient beforehand to explain what you're doing, because that can, that's a real difference.
Well, it's like I've seen a lot of where it really opens up your eyelid. Does that make sense? So it almost looks like your eyelid is, or is that for hooded eyes? Is that what it's called? Yeah. And so it
if you
looks bigger.
Yeah, it looks bigger. Right. So that won't change the actual shape of your lid position, but the upper lid will be further back, and you'll see more what's called upper lid show.
Yeah.
I mean, that's kind of the desired goal. Now, if you if you cut out too much,
then it
might look too open and too hollow.
Yeah.
And that, might be a technical error.
Right.
And then
that would be tough. I mean,
that's a hard thing to fix.
That would be tough to do something like that, and then you hate the way you look. I mean, would be.
It's not an easy profession.
Jeez, that would not be good.
We take, take a look at we take beautiful people and we try to cut them open and then make them feel that they're more beautiful afterwards.
Yeah, right.
So it's not not a lot of room for error in the field.
No, I know that is tough. Have you ever had someone come to you and you've had to say that you won't do something just because they do so much? Yeah.
That's my favorite thing to say.
Really?
Oh, yeah.
Because people just go overboard, right?
Yeah. And, that's kind of the key, right? You need to recognize, you need to stay true to your own aesthetic. And you want to do the right thing by your patients, right? It's still medical care end of the day. And sometimes people ask for things that aren't good for them or are not really appropriate. Or
like what? Like what's the craziest thing someone's asked you for that you're like, I
was
just
like-
can't do that?
You know, in nose surgery, like in rhinoplasty, they're like, I need my nose to be smaller. And they have like an extremely, like it's already an undersized, juvenile appearing nose.
Yeah.
Where people have kind of lost the horizon.
Yeah.
It's super common with like filler patients, right? They're like, I need more because they
Okay,
think
right.
they want more volume and they're already chipmunks, you know?
Yeah.
So,
Oh, so you say no to even the filler and stuff too?
oh yeah.
Yeah.
Oh yeah.
Oh my gosh. Right. You do Botox and filler and on
In the office.
Yeah.
I mean, I do very little of that, but you know, we all, everyone in my office, we all hew to a conservative, like elegant aesthetic.
Yeah.
And we want to give people, you know, what they need. And honestly, I find people will end up being on your page if you spend the time to educate and
Yeah.
explain, right?
That makes
People think they
sense.
want, you know, really common when it comes to boobs. My girlfriend has X cc's. I want that. I'm
Oh
like,
yeah.
"Well, your girlfriend's 6 feet tall, and, you know, you're 5 feet tall. So like
Yeah.
you would look ridiculous with that. That doesn't fit you." And like, oh, I get
Oh,
it.
right. People always ask me what CCs I have. I don't even know, but I'm always like, it doesn't matter. You have to do
That's
it to
exactly
your
right.
body. I'm like tiny. You're going to want
exactly
bigger
right.
ones than I have. Trust me.
Yeah.
Mine are tiny.
All that matters is that it looks good in your figure and your frame and fits your body, right?
Yeah,
The
exactly.
number doesn't matter.
Do you find that with your boob patients, when they come back to do them again, do they always want to go a hair bigger though? Or no?
Not always.
Not always.
So again, I hew pretty conservatively. I always try to use the least amount of volume to give the desired result. So if you want to be bigger, that can still be, you know, on the fuller side of what fits for you. But I want you to have, you know, a super long lasting result.
Yeah.
The less weight and pressure there is, the longer lasting it's
Oh,
going to be. Your
yeah.
tissue's not being taxed and stretched as much.
Okay, yeah.
So I would say in my practice, because I spend a lot of time going over things, there are very rarely requests for like size, like real changes. On the rare occasion it does happen, they usually want to be a little bit bigger, especially
Just like
because
a hair.
Yeah, like I
Yeah.
start like smaller.
So do you kind of encourage patients to go a little bit smaller maybe sometimes than they come in wanting?
It's really funny, you know. Again, we all kind of end up with our like a certain type of patient based on our prior patients.
Yeah.
And so women, the typical path is they come in like, I want to be really small and cute and perky and model ass. I'm like, cool, no problem.
Great.
Like, but wait, I don't want to be too small.
Yeah,
I want to
yeah,
make sure. I was like, yeah, I know you're paying for surgery. You want to make sure you can tell. You don't want to be
every
huge.
girl, yeah.
It's like this little dance we go
Yeah,
through.
it's
And
so
It's
funny.
the first time for them. It's like
Yeah.
the 10,000th time
Yeah.
for me. I'm like, yes, I
I know how this ends.
I'll
I
hit
got
the button.
it.
I'll
Yeah.
keep playing the speech.
That's so
But
funny.
you know, you do want to understand what people are looking for, what they're thinking about.
Mm-hmm.
You know, cup sizing, as you know, is like fake. It depends where you go.
It's such a joke, yeah.
But I do let people kind of walk me through what they think, because different cup sizes mean different things from like an American standard standpoint. So
yeah.
we can usually, with enough time, really arrive at a place where we both feel good about it.
Yeah.
And
Yeah.
it tends to work out pretty well.
What's a surgery that is just not worth the hype?
Surgery not worth the hype. I mean, listen.
Or like, you know, everything has like a trend. Like there's
Yeah,
all, like,
okay, fine.
buccal fat was a trend. Like what's the like?
How about like so we talked about brow lift earlier. We
Okay, yeah.
get super into it.
Yeah.
But there was this massive Hollywood trend, right, where everyone was getting like
I think I know
this
it.
fox eye thing.
Yes.
Their like brows like touching their
Yes.
hairline
and
or
like
something
young
absurd.
girls, like in their
Super young.
20s. Yeah.
Uh-huh.
Not worth the hype.
No, bad
So
idea.
that's just like a facelift specifically, or like a brow lift.
Yeah, or like a temple lift, right?
That is
so either with stitches that come all the way down to the brow, or cutting the skin out inside your hairline.
Wow.
Pulling super hard and trying to overly aggressively elevate the brow.
Okay, yeah.
That ain't coming back down, and
Yeah.
that might go out of style. So don't do things that
They're trendy.
are trending.
Okay, so what's like the next big trend in plastic surgery? Like what's something that we don't even know about yet that everyone's doing?
What's the next big trend?
Like buccal fat had its moment,
Yeah,
right? Is that
right.
kind of like gone? Not gone, but like
I mean, listen, I'm not on TikTok, but I think it's like not as trending on it anymore.
Yeah.
So listen, like buccal fat pad
buccal,
removal.
I don't even know how to
yeah,
say it.
It's fine. It's fine. I was like, should I just go with the other pronunciation?
I'm actually kind of happy I don't even know what the fuck it's called.
So buccal fat pad, that's a little like egg yolk fat sac that's inside the cheek.
Oh, it's a sack that you take out?
Yeah, it's like a little pad. It's like a little circle. It kind of looks like a yolk. It's this
Whoa.
little enclosed fat pad. It's between the muscles of mastication or the muscles of chewing in your mouth.
Okay.
So it's there for a reason.
Yeah. Oh, yeah.
Everyone wanted these like super snatched, super sculpted looks. I think that. So I think the trend, if you will, is away from the old trend. super defined liposuction, super defined face shape,
Yeah.
kind of overdone, overly sculpted.
Yeah.
People are finally, the pendulum is swinging back towards a natural aesthetic. So when I do
Yeah.
liposuction, high def lipo, which I learned from my friends in South America. They're the experts on it. I've seen everything they do.
This is
I've
like the
spent time-
full body sculpting that they
the
do, right?
crazy
Like the
contouring,
whole
the
body.
abs and the everything.
Yes. Oh my God.
My line was always like, I want you to have some shadowing and curve, right? But I call it soft def.
Okay.
Like soft definition liposuction.
Yeah.
That is now becoming what everyone is going for. it turns
Okay.
out. Because
Yeah.
that overly defined look might be great in an Instagram picture that's
Yeah.
1 inch square, down the beach.
Yeah.
But you see these people in real life and they look like they have like scars all over themselves.
Yeah,
It doesn't look good.
Crazy.
Yeah, I'm sure you've seen tons of it. In
Yeah,
LA
I mean
and-
LA. Well, everyone was doing that full body sculpting for a while.
Right.
And I actually know someone who had a crazy scar along their whole stomach and it got infected and it was like a whole thing. And so I was just like, I don't know, some of this stuff just seems so intense.
Yeah, you always want to, there's some interesting ideas out there, but it's usually good to kind of find a middle ground and get the results in the shape you're looking for. I mean, you don't need to have saggy eyebrows, but you just want to get them rebalanced, right? I
Yeah.
mean, brow lift results, in my opinion, should never be like shocking. It should
Yeah.
always be just stabilized and pretty and just in the right spot.
Okay,
Same
yeah.
thing with body contouring, same thing with cheek highlighting, same thing with buccal fat. And the problem
Cheek
with this,
highlighting? What?
yeah, like fat grafting or
Oh.
adding volume to the
Oh,
cheeks
oh,
or
okay, yeah. Oh,
contouring
yeah, yeah.
underneath. And so the reason why this buccal fat thing is such a problem is because fat in your face, like we've talked about,
Yeah.
dissolves as we age.
Yeah.
So the buccal fat pad is no different.
Mm-hmm.
So all these kids, these 20-year-old girls are going and trying to get super snatched faces, and they're plucking this pocket of fat out of their face when it's nice and full when they're
Yep.
young. And then they get older.
Yep.
And then they look gaunt and hollow like a skeleton.
Yeah.
And that fat isn't coming back.
Yeah, you don't want to take fat out of your face. You're going to want that.
Right.
Yeah, that's what everyone is saying on TikTok. Like,
Right.
stay away from it
Yeah.
because of that reason.
Now, there are some people that have, just like in the lower eyelid, it can be a little poochy or prolapse or sticking out, especially in a facelift patient who's not a kid, right?
Yeah.
And so I will, a couple times a year, there's someone that has just too much fullness. You can take part of it out in a 50-year-old.
Okay, right.
And that's reasonable.
Yeah.
Because that's much more stable. A lot of the aging has gone on, and you're trying to create a little bit of a softer, better contour.
Okay.
But yeah, the overdone 20-year-old taking it all out thing is a bad call.
No, it's crazy. Wait, what is the average age for a facelift? Yeah.
So the average age in my practice is like late 40s
Okay.
for a
Okay.
full facelift.
What's the youngest person you've ever done a facelift on?
30.
Yeah, I was going to say. There's rumors of a certain actress who looks really good. I'm not going to say it though, but that she started getting facelifts at age 30.
Yeah. I mean, I would say the 30-year-olds that I've done full facelifts on have had massive weight loss.
Oh.
So, you'd be super full and then you kind of lose a lot of volume and everything's
Okay.
hanging and low. So it's almost reconstructive in a way.
That makes sense.
Now, I will have done plenty of neck lifts or lower facelifts on women and men in their early 30s.
In the early 30s. Yeah. Just to get ahead of it kind of
Well,
thing.
that's kind of the end of the age where you can just address the neck.
Okay.
Because once you get into your 40s, the cheeks are starting to sag too.
Yeah.
So if you're 32 and you have a little bit of fullness and you don't want to do something minor and there's a little bit of hangy skin,
Okay.
if it's tight and you're 20, you can do a little suctioning, right?
The lipo right there. Okay, yeah.
And it'll snap back.
Oh.
But if your skin's already getting a little lax, right, we got to match that skin and the deep tissue.
Yeah.
And so you're better off taking the muscle. Again, it's the most natural look. It's a little more involved.
Okay,
it's a little
yeah.
more expensive. Takes a little longer.
How much is like the neck facelift?
That's a great question.
Do you not want to say? You don't have to.
Well,
Expensive.
Yeah, it's
Nothing's cheap.
Nothing's cheap. No,
You don't want to get a discount either.
Yeah, discount on facial surgery.
2 for one.
Probably not
Yeah.
your best move. I don't really keep tabs on it. Honestly, that's I tried to.
The office does it.
Yeah, I try to keep what I do focus on what I want, what the patient needs,
Yeah.
and then the financial aspect can be handled by the office side.
Yeah.
It's a very awkward thing, right?
Well, I get
you
it.
want to be. I just want to do the best thing for the patient. It's kind of my art. It is my art. And,
I'm the
you know,
artist. I
yes,
don't know about
don't
numbers.
know.
I don't know the numbers.
but it's a lot.
But I do know it's a lot. Great. I'll start saving up now. Okay. So what's one thing that we're all sleeping on? What's one thing that we should all be getting done? Even if it's a laser.
Yeah. Okay.
Or,
Okay. Honestly, I'll take you a step further back than that. The
Okay.
one thing we all need to be doing, okay, and all the dermatologists should like this, Sunscreen is one, but that's
I just
boring,
got
fine.
killed for saying I don't wear it. I know. Let's just say something else.
I don't know if we can be friends anymore.
I know.
Okay. Sunscreen. Listen, you need the sun destroys the structure of your skin. Never mind skin cancer. Right?
Yeah,
That's a problem.
Yeah.
But you need to. So fine. The step above sunscreen, which is the protective aspect. One of the true kind of fountains of youth is things that help increase cellular turnover in the face.
Okay, yeah.
So like retinol, retin-A,
Okay.
retinoic acid,
Tretinoin, all the,
exactly,
yeah,
tretinoin,
okay.
yeah.
Yeah.
And so using these creams every day, right, which is actually super trendy for like young people. They're probably overdoing it at super young ages.
Right.
But you want to encourage your skin to build new collagen, maintain elastin, remove that top layer of dead skin.
Okay, yeah.
And so these products they're irritants, but they actually have been proven with very good science to really keep your skin pretty and fresh and young. And that is going to only benefit you.
Okay. Yeah. That makes sense.
Good skincare, medical grade.
Yeah.
There's all these fancy creams at Saks and, Neiman Marcus. Most of those things have very little active ingredients and cost a lot more than just the stuff you can get at your dermatologist or your plastic surgeon's office.
Okay. Yeah. Cell turnover. I know it is true. Great advice. Okay. Tell everyone where they can find you, where they can book their facelifts.
So I'm Jacob Unger. I'm in Nashville. I'm in Hillsborough Village. My practice is called Nashville Plastic Surgery Institute.
Instagram.
Instagram. Yeah. Dr. Jacob Unger, Dr. Jacob Unger, on Instagram. And
I guess, yeah. I guess that's it.
I guess that's it. That's the address. That's, there's a website.
What's your
and
home
everything.
address? No, I'm just kidding. Give them
If
your
you like a home,
give them your home address.
here. I actually live here with Kristin every other week.
Oh my
We're super
God.
close.
Thank you so much. I just learned
you.
a lot. So I think obviously
This is
everyone's
such a
going to
blast.
be.
Well, let me just say, and you may cut this, but let me just say that you are such a sweet person. I feel very
sweet.
fortunate to have you as a friend. You're one of the most humble and kind people I've ever gotten to know. And so thank you very much for having me on the
Thank
show.
you. I'm not cutting that. Are you kidding?